Hi, my name is Heidi Benke. I'm the Director of Rehabilitation at Weiss Hospital and a physical therapist. I'm here today to talk to you about the physical therapy program to anticipate your needs after joint replacement surgery. Physical therapy will begin actually the day of surgery. It actually depends on what time the surgery is completed and the timing that you're up on the floor. If you're up on the floor, usually early afternoon, then the physical therapist will be coming in and sitting you up on the edge of the bed. If you feel well, we're going to go ahead and have you try to stand up and actually get you into the chair and walking in the hallway if that's appropriate. If it's a little later in the day and you're feeling groggy from the anesthesia, the nurse is going to help you up to the edge of the bed, and you'll just be sitting up on the edge of the bed for a few reasons. One will be to help to prevent any blood clot formation. The second is to help prevent any pneumonia or congestion in your chest. So we'll be getting you up in some fashion the day of surgery. The day after surgery, we'll be coming in to see you early in the morning. We try to coordinate our timing of coming in to see you with when you've had your pain medication. You can anticipate to be working with a physical therapist twice a day, every day that you're here. We'll begin with an evaluation to determine how you're moving. We'll help to assist you to a standing position and walking. We'll walk with you as far as you can tolerate. We will also perform some routine exercises with you and ensure that you're getting the mobility that you need in your joint. Again, in the afternoon, we'll come back and do those same things with you. We'll be going through your exercise program as well as walking and performing transfers. On the second day that you're here, you can anticipate many of the same things that you did on the first day. The second day, we're going to also have you stand up, walk down the hallway as far as you can, and we're going to go through an exercise program that you should continue while you're at home. On top of that, we are going to have you perform stairs if you need to be performing stairs when you go home. In the afternoons, we do perform another session of therapy. Depending on the number of patients that are here on the floor, it might be in a group format. So you'll have an individualized session of therapy in the morning and a group format in the afternoon. The group is a nice way to perform your exercises because you can encourage one another to get either higher numbers or to stretch further, to walk farther, and that's the reasoning that we perform those exercises in a group. It's to kind of make it a little bit more fun for the patient and to encourage one another. If you stay till the third day, you can anticipate getting therapy the morning before you leave. Our discharge time is usually around 11 or 12 o'clock, so we'd like for you to get that first session of therapy and then you will be discharged. At discharge, we'll make sure that you're set up with all the equipment that is needed. So we'll ensure that you have a walker. We do like if you have a walker for you to bring it into the hospital so that we can ensure that it's the right height for you. If you don't have a walker, don't worry, we'll set you up with all the needed equipment prior to your discharge. If you are going to a rehab facility, sometimes we hold off on that equipment because those needs might change within the week or so. You should expect usually to walk with a walker for the first 2 to 6 weeks. People progress off the walker at different times depending on how strong your muscles were before surgery and how you feel after surgery. So at times, patients will use a walker for a very short period of time. We like walkers better than crutches because it allows a more fluid gait pattern and it assists with balance. Sometimes patients leave the hospital actually using a cane, but for the most part, expect to use a walker for a few weeks and we'll progress you off that walker as quickly as possible. A few things to remember while you're here in the therapy session is that you will be getting dressed every day. It's very important that you bring nice supportive shoes, something that will give you support. We do not like slippers or flip-flops because those can cause some fall or trip hazards. So a nice supportive gym shoe is ideal, or a shoe that is supportive that you can slip your foot into, especially if you're having a hip replacement. You won't be able to bend forward and tie your shoes due to the hip precautions. So we like to have a nice supportive slip-on shoe is ideal. If you don't have that, a gym shoe will work just as well. I like to recommend that you have a loose-fitting t-shirt and either shorts or sweatpants, something that's easy to kind of get up and down so that we can take a look at incisions, but also covers you while you're walking in the hallways. You will expect to get up with a nursing team early in the morning, Prior to therapy coming in, we'd like for everybody to be in the reclining chair, and you'll stay in that reclining chair all day long. We know that many of you are having this surgery because you're trying to enhance your quality of life, and in doing so, that's going to be spending most of your day out of a bed. So the recliners do recline back so that you're able to take a nap in the chair and rest comfortably in the chair, but we really like to keep you out of the bed and upright for most of the day. We work very closely with our nursing team to help to manage your pain. So something to expect is to have us continually putting ice upon your new joint. We will use that ice to help with pain management as well as the edema. We will take the ice off when you're here in therapy, and then when you come back or you return back to your room, we will put the ice pack back on that. We like for you to recline back for edema management, but we also like you to sit upright, especially when you're eating your meals. So our rule of thumb is that for all meals, you're sitting upright at a 90-degree angle. It helps with digestion, as well as it helps with the range of motion in your new knee joint if you've had a new knee, or it stretches the musculature if you have a new hip. So we like for you sitting upright for all of your meals. If you're having a hip replacement surgery, you're going to have 3 precautions that you have to follow for at least 3 to 6 weeks, depending on what your surgeon's protocols are. The hip precautions will not allow you to do 3 different things, and I'm going to demonstrate what those are. The first is that you can't bend forward beyond a 90-degree angle. So if you look at the angle of my hip and the trunk of my body, this is a 90-degree angle. When I bend forward, I'm actually breaking that angle. After surgery, you will not be allowed to bend forward beyond a 90-degree angle, as I said, for about 3 to 6 weeks, depending on the precautions. Most of the time, it's 6 weeks. There are 2 other things that you won't be able to do. One is to cross your legs. It will feel painful when you try to do this initially, so it will naturally stop you. But as you start to feel stronger and better, you'll be more naturally inclined to cross your legs. It's a big no-no, again, for about 6 weeks in crossing your legs. The third thing is that we don't want you to turn your toes inward or become pigeon-toed in any way. The times that we're naturally inclined to do this is as we get in and out of bed or as we get in and out of a car. So the therapist is going to work with you to instruct you on how to do those things without turning your toes inwards. So just to review the 3 precautions, there is no bending forward beyond a 90-degree angle. There's no crossing your legs over midline, and there's no turning your toes inward or pigeon-toed. So we will work closely with you to ensure that you know those protocols and that you don't break those hip precautions. If you're having a total knee replacement, we're going to work with you on 2 very specific exercises. The first is we want to have you be able to straighten your knee to what we call 0 degrees, or to be completely straight, 0 degrees of extension. The second is for you to be able to bend your knee to a 90-degree angle. So I'm trying to demonstrate a 90-degree angle right now. We generally have about 120 to 130 degrees of flexion in our knee. We want you to have 0 degrees of extension or being completely straight prior to your discharge on the 3rd day, and have at least 90 degrees of bend in your knee before you go home on the 3rd day. The therapist will continue working with you to get that original motion back as you continue on with either therapy in a rehab setting or in an outpatient clinic. The final thing I want to tell you about is occupational therapy. If you're having a total hip replacement, the occupational therapist is going to come in to see you and help you to get set up with the equipment that you need to maintain your hip precautions as you go about either dressing yourself or bathing yourself. They do have what I call the bag of tricks. It has a variety of pieces of equipment in that will allow you to be able to put your socks on, to be able to dress yourself, to be able to bathe yourself in a way that you're not bending forward and breaking those precautions. Unfortunately, those pieces of equipment are not covered by insurance and is an out-of-pocket expense. You can get them at a local Walgreens or any DME facility where they sell ADL equipment. We do not require you to purchase those pieces of equipment, especially if you're going to have a coach, because they're short-term precautions. But if you are going home independently and want to live as independently as you can, there's certainly much needed to maintain those precautions for those first 6 weeks or so. you will if you're having the hip replacement surgery, you will be maintaining those precautions until you are cleared by your surgeon to no longer have to utilize those precautions throughout your daily activities. I want to thank you so much for your time, and I wish you the best after surgery.